So one of the most common causes of a knee replacement or knee replacement surgery is arthritis in the knee, specifically in the patellofemoral joint, otherwise known as chondromalacia patella. The patellofemoral joint is really just the joint formed between your kneecap here and the femur behind it. The kneecap, or the patella, is supposed to sit directly between these two bulbous condyles of the femur. That way, when we move, that patella or kneecap tracks very nicely between those two condyles in the groove between them. Oftentimes, if someone has had an injury to the knee in the past, they are going to be much more likely or prone to having arthritis of the knee in the future if it is not rehabbed correctly. The reason for that is that we have 4 quadricep muscles and 3 lines of them. We have 2 overlapping each other coming straight down the midline of the femur. On the inside, we have a muscle, or one of the quadriceps, known as the vastus medialis, and on the outside, one of the quadriceps known as the vastus lateralis. Just about any time there's an injury or pain around the knee joint, we wind up with the same reaction in the quadriceps. Whereas the innermost quadricep, the vastus medialis, winds up going weak in response to the pain. And the outermost, vastus lateralis, continues to exert the same amount of tension. The result is that the kneecap, or the patella, gets pulled slightly to the side or laterally. This causes a lot more rubbing or friction underneath the patella and eventually leads to degeneration or arthritis. So if you've had an injury around the knee, and especially if you've had an injury around the knee in the past and you don't feel like your knee works completely 100% the way it did before your knee injury, then you're probably going to want to explore doing some exercises to 1, strengthen your vastus medialis, specifically the part of it known as the vastus medialis oblique, and 2, lengthen your vastus lateralis. Those 2 ingredients will go a long way to helping you prevent any further knee pain or prevent you from needing a knee replacement in the future.